Hello everyone, my name is Sheila Oliver. Today we will demonstrate to you the proper way to change a left ventricular assistive device or LVAD dressing. It is important to follow each step correctly in order to prevent infection. The patient and the caregiver will be shown steps for doing exit site care before leaving the hospital. With me today is one of our LVAD coordinators, Jocelyn Rivella, to demonstrate to you the proper way of doing Driveline exit site dressing. To start with, we need to collect all supplies needed. You will be needing a clean surface or to put your kit. Here at the Michael E. DeBakey, we use two types of dressing kit, daily or the multi-daily. It is necessary that when we change the LVAD dressing, the patient needs to lie down in the bed in order to have proper exposure of the area that we're going to work on. Let's begin with washing hands prior to every Driveline exit site care dressing change. Good hand washing technique needs to be observed in order to keep the exit site clean and free of infection. Let us start with the daily kit Driveline exit site care. To begin, open the dressing kit and place it on a clean surface. In the first top pocket, there are a pair of hair covers and masks provided. One for the patient and one for the person changing the dressing. Put on the non-sterile gloves and remove the outer dressing using the remover wipe while holding the Driveline in place to prevent tugging on the exit site. Now, remove the old gauze and silver pads. Perform skin assessment of the LVAD site. Exit site stage. Presence of drainage. Observe signs of infection such as redness, tenderness, swelling, draining, bleeding, or bad smell. Call your LVAD coordinator or hospital contact person after completing dressing change and inform them of your observation. Treating infection early is very important. Now, take off the non-sterile gloves and discard them. At the bottom pocket, remove the hand sanitizer and sterile gloves and set them aside. Open drape by pinching at the pinch here labels. Make sure not to touch the inside parts wrapped to keep the inner contents sterile. Use hand sanitizer to clean hands. Apply sterile gloves using sterile technique. There are 3 different solutions to use. You can use one or the other depending on the patient's skin reaction. When using chlorhexidine, apply for 30 seconds and allow to dry for 30 seconds, cleaning the skin starting from the Driveline site to outer surface of skin. When using alcohol, apply 30 seconds and allow 60 seconds to dry. Clean the skin, performing a circular motion starting from the Driveline site to the outer surface of the skin. When using povidone iodine, apply 3 minutes and allow 3 minutes to dry. Clean the skin, performing a circular motion starting from the Driveline site to the outer surface of skin. Depending on the sensitivity of the skin, you can use alcohol or povidone iodine. Application and dry time are indicated depending on what solution you use. Allow the skin to dry completely before putting the Silverline on. If we don't let the skin dry completely, we risk it causing irritation, discomfort, and increasing risk for infection. We know that the skin is dry if we no longer see the sheen of the solution on the skin. It will normally take 30 to 60 seconds to dry. Dampen Silverline dressing with a saline wipe and place the silver side down around the Driveline site in such a way that the Driveline rests upon the slit portion of the Silverline. Next, apply the new dressing. For a patient with sensitive skin, a barrier film pad may be used to wipe the area where the dressing and anchor adhesive contact the skin. Next, there are two gauzes available. One is with the slit in the middle and the other has none. Gently tuck the gauze with the slit in the middle around the Driveline site, followed by the 4x4 gauze over it. Apply large dressing over 4x4 drain gauze dressing, smoothing it down so that it sticks to the skin. Apply closure piece over the Driveline and over dressing. At this point, let's move to the securement device. Remove the LVAD securement device. Wipe and dry the site. Clean entire application site with alcohol wipe. Allow to dry. Wipe entire application site with BioPlus and allow 15 seconds to dry. Remove the release papers from the hydrocolloids adhesive oval. Press the hydrocolloid oval to the skin for 15 seconds to seal. Place tube on the soft, no slip grips. Pull and secure. Pull the straps tight to secure. Thank you for watching.